Tonight in a NewsNation special report, surviving a life-threatening case of COVID-19, only to realize that was just half of the battle. It is a problem thousands of people across the country are now facing as a result of the pandemic. We're talking about the fight for workers' compensation. And tonight, we are bringing you a story of Travis Crawford, who says he got sick with COVID-19 after his shift at the county jail in Colorado. The virus nearly killed him, and now he is struggling to fully recover. Correspondent Lori Jane Gliha explains why the problem with benefits may depend on where you live.
What a life Travis Crawford had.
I'm gonna take another chance card.
Bye.
Watching his little one grow up and making the most of the outdoors with his girlfriend and family.
Hi.
He liked his job, too, as a sheriff's deputy in Mesa County, where he frequently trained for his job in the jail. In June 2021, he got COVID.
It was scary because he kept coughing really hard.
See someone you love unconscious on a breathing machine. I think that was probably the scariest moment of my life.
Crawford says he was on a ventilator and had to be flown to the Denver area where he nearly died. Before he went in, a friend promised to care for his son, Arden, if he didn't survive.
He would make sure that my son knew who I was, and that he would move wherever Arden ended up and make sure he was taken care of. And that was a kind of a peaceful feeling to have.
Crawford says he spent nearly 3 months in the hospital, and while he was fighting for his life, the sheriff's office terminated him because he was unable to return and work the essential functions of the deputy sheriff position.
I certainly could not have fought with an inmate. I certainly could not have wrestled with somebody or tried to gain arrest control.
He applied for workers' compensation, saying he contracted COVID-19 at the jail. He argued he had been in direct contact with inmates and coworkers who were sick with COVID-19. And the state health department documented an outbreak at the sheriff's office around the time Crawford got sick. But Crawford also attended his grandfather's funeral in that time frame, raising questions about the possibility of other exposure. And the company responsible for approving his claim, TriStar Risk Management, would not grant the benefit. They also declined an interview.
The burden is always on the injured worker to show that the disease or the injury occurred within the course and scope of their employment.
Paul Torriello is the director of Colorado's Division of Workers' Compensation and says proving someone got an illness at work is much more difficult than proving an injury like breaking an arm.
Early in the pandemic, that was a lot easier because there was not what we call community spread.
Hundreds of thousands of people around the country who believe they got COVID at work are filing claims. But every state has its own process.
It really does run the gamut. I mean, every state's law is different.
Jeff Ettinger represents the National Council on Compensation Insurance, or NCCI. The organization conducts workers' compensation research in Washington, D.C. and 37 states. In those places, he says insurance companies paid out more than $500 million related to more than 60,000 claims in 2020 and 2021. We asked for context that would show how many claims are denied. But we learned NCCI's research doesn't include national denial data.
This is not a situation where insurance companies are pushing and saying we don't want to cover this, or we're trying not to cover it. It is covered. It is being covered, and claims are being paid. In
Colorado, where the denial data is tracked, more than 12,000 people applied for COVID-related claims between 2020 and 2021. 72% of those were denied.
The denial rate has actually gone up over time, and we believe that this is a direct correlation with the fact that the disease has spread that much further in the community outside of people's workplaces, therefore making it that much harder to prove that it was a work-related exposure.
According to NCCI, in 2020 and 2021, 18 states enacted special legislation or rules that presumed certain workers who got sick with COVID, like healthcare workers or first responders, are more likely to have gotten the illness on the job. Colorado never passed a similar law. Crawford says he's not sure why his case is so hard to prove, especially after he learned of this letter signed by the undersheriff. It includes an analysis of Crawford's illness to see if he could qualify for a federal public safety officer's benefit program, which presumes any first responders' COVID-19 complications occurred in the line of duty if they meet certain criteria. This letter says Crawford's COVID-19 diagnosis came 3 days after his last line of duty shift, and that it fits all of the criteria to be considered a disability that occurred in the line of duty.
I'm depressed and I'm going through therapy trying to manage and mitigate all that. But I have to pay for therapy out of pocket. I have to do all this stuff on my own.
The fight now is one step at a time. But for Crawford and many Americans across the country, each literal step just causes more pain.
We reached out to several states with big populations, and they all make payouts and denials at different rates. Crawford, by the way, filed a lawsuit against TriStar. That company declined our interview again, saying privacy laws and their own policies prevent them from even acknowledging that a claim had been filed. I'm Lori Jangliha. Back to you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.